somebody has been able to enter medical school. So now we know it's going to take us 6 years to finish medical school.
All right.
So the 6 years, what are you basically studying? Is it basically, are you doing theory? Are you doing practicals?
Okay.
Do you go out to are you in contact with patients?
All right.
Then after that, how's the whole experience of medical school like?
Okay. So it's a mixed bag. You start with the theory. We call that the basic sciences. So basic sciences is when you are being introduced to medicine. So you are doing anatomy. Anatomy is grossly what is the body parts. So the head, the ears, the neck, the thorax, the abdomen, all that. So that we are in your basic sciences, they are teaching the theory of that, and there's a practical session of that where you actually work on cadavers.
Hello guys, welcome back again to the channel. My name is Joshua and I'm going to be your host. We are starting a new career series on Daily News Hive where we go into the lives of professionals. We ask them how they got to where they got to, the process of which they acquired their education, how the working life is. So they can help you to also make an informed decision whether you want to transition from career to another career, or you would like to also, maybe you're a student in SHS thinking about what career you would like to do, or you're a parent of a child and you want to advise the child on what career to do. This video is for you. So today we're going to talk about one of the most popular professions, dignified professions in Ghana and the world, and that is medicine. We're going to talk about the things that you should know before becoming a doctor in Ghana, the things you wish you knew before becoming a doctor, the things you should know as you finish medical school, and generally stuff about medicine and working as medicine, as a medical officer or as a doctor in the country. So stay tuned. Don't forget to like the video to encourage us to continue posting such content like this, and subscribe also to the channel. So let's jump straight into the video. Dr. Agyemang Abebio, you're welcome to Daily News Hive.
Thank you, Joshua.
So kindly introduce yourself to us.
All right, my name is Dr. Nana Akwesi Agyemang Abebio. I'm currently in training, specializing to become a pediatrician.
Wow.
So I have barely 4 months to pass out as a pediatrician.
Wow.
So I'm currently at a Kolebo Teaching Hospital, but my primary facility is the Greater Accra Regional Hospital.
That is rich.
Yes, that's rich.
Okay.
Yes, that's rich.
Yeah, that's great. So I realize that you don't have any English name.
I do, but not so formal. So there are times that I use it, other times I don't. It's actually on my birth cert anyway, but most of my certificates doesn't have it. So
you don't use it?
It's Selwyn. Selwyn means a clear voice to be used in the service of God.
Oh.
So that's my English name.
That's a powerful name.
Yeah.
Okay.
It is.
So let's talk about medicine. Medicine is a lot of people every year from SHS, in Ghana, even from other schools around the country and outside the country, West African schools, all apply to Ghana to become doctors. And most people want to become doctors. Most people want their children to become doctors. It's a very popular profession. But before we talk about how to even apply to medical school, what I'll first ask you is that what was your best experience working as a doctor been so far?
All right, so let me share this. There was one time when I was at Greater Accra Regional Hospital. That's before I started training to become a pediatrician. I was still with the child health department in Greater Accra Regional Hospital. So there was one time I was going for a night shift, and I was running a bit late, and my boss called me that they're expecting this baby who had just been born, and the mother is a doctor, the father is a doctor. They had been trying to, they were bagging. If I say bagging, they are literally trying to put oxygen for the baby to breathe, because the baby had some complications. Yes, when during delivery, so came out floppy, couldn't breathe, couldn't hold up respiration. So they had been bagging, literally giving oxygen manually to the baby at Kolebo, and it wasn't really going well, so they needed a ventilator. And at that time, Kolibo didn't have a ventilator. A ventilator helps, the babies, and not just babies, all other patients who are able to hold their breathing. It breathes for them till they are able to breathe on their own. That's literally what the ventilator does. So they had called Rich that this is the situation and very dire, and then they want a ventilator as much as possible, so if there's any available. So my boss had said, okay, there is one available, so you can bring the baby. And there's a baby born to doctor parents.
Yeah.
All right. So on my way, my boss called me that, are you in the hospital? I said, oh, I'll be there perhaps in the next 10, 15 minutes. He said, okay, then be very snappy because we have this case at hand. And I know you can intubate. So once the baby gets there, intubate and put this, the ventilator should have some settings. Do that, and then you give me a call. Let's see what happens. And intubation is a skill, all right? It is a skill that even most specialists, if you don't go through the skill training, you may not acquire it. And at that time, as a medical officer, I'm not a specialist then. I was still able to intubate because we had been trained. So my boss had trained all the medical officers under her care, so we could easily intubate. And it's a skill that comes in handy because in such instances, once you're able to intubate and you put the child on the ventilator, you can save the life of that child.
Oh.
So I got to the car park and I noticed the ambulance had just arrived.
Hey.
They were trying to get the baby and then all of them out into the unit, and I could really see the doctors manually bagging the baby so the baby will not stop breathing. So I ran into the neonatal intensive care unit and I changed into my scraps. So by the time I was ready in my scraps, they had brought the baby in there.
Wow.
And then I positioned the baby, and just a single attempt, I was able to locate the airway and put we call it endotracheal tube, and put it in. And I connected everything on the machine. I got the settings. And this child who was struggling to breathe suddenly was all pinking up because all the settings were right and everybody was excited. And then I overheard one of the specialists whispering, who is this? Is he a specialist? And I knew one of them because I was training Kolibo, so I knew. He said, oh, he's a medical officer. This guy is really good.
Wow.
And after a day or two, this baby had been weaned off the ventilator. Mostly, depending on your situation, you can stay on the ventilator for long.
Wow.
But this baby, after 2 days, were able to extubate, and the baby was breathing on his own.
Wow.
And you know what? The most satisfying thing was years later, I start residency in Kolibo, and I walk into one laboratory office. I was going to do a lab test. I walk in there, I was seated, and the doctor walked in. The doctor whose child had intubated and saved.
Wow.
Not saved, had intubated and walked in and said, Dr. Hajiman, I saw you walking in, and I said, you need to know this. So I came in to tell you that your baby is fine, your baby is running about, your baby is doing so well, he's now a big boy. And I'm like, wow, this is so satisfying. You see, so that's one of the numerous experiences and the numerous stories that we have to, I have to share.
Wow.
But that is really one of the greatest experiences that I can share with you.
Wow, that makes my next question even easier. How is medicine as a profession? How is it like to practice medicine in Ghana?
Oh, personally, practicing medicine has been very rewarding for me. It's like it's a childhood dream that came to fruition. So I live every one of them so well, and I'm always excited to give a helping hand in terms of helping people go through their woes, go through their health concerns. So I take it upon myself to educate parents. I will say parents more because I deal with children. So to educate parents about their children's condition so that they have informed knowledge about things happening. So you don't rush into other unnecessary areas to seek for help. So medicine is great. It's a childhood dream that became fruitful, and every day I live it well, and I focus on bringing comfort to people.
Oh, wow, that's great. So now, if I was maybe an SHS graduate, I've just written my WASI, or I had finished school some time ago and I want to become a doctor, what's the process like in Ghana? How does one become a doctor in Ghana?
All right, so I train in Ghana. So in Ghana, there are the private schools and there are the public schools. And even with the public schools, we have University of Ghana Medical School. It used to be, I think it's now University of Ghana School of Medicine and Dentistry.
Okay.
And then we'll have the medical school, School of Medical Sciences in Kwame Nkrumah University of Science and Technology.
University.
We have School of Medicine too in UCC, UDS to have School of Medicine.
UHAS?
Yeah, UHAS too, yes. And then there are private institutions, Accra City College of Medicine and then Family Health, yes. So those are the few ones I know about the private ones. And in essence, especially if you're a science student, everybody wants to, not everybody, but majority of people wants to read medicine. Because not long ago, one of my nephews was talking to me about his desire of reading medicine. He was an SS, and I told him that, before you can even get a ticket to apply to read medicine in Ghana, you should make sure you are clocking your A's. If you can't get an 8A, minimum get 7 A's. So concentrate and focus on the SS aspect. Get your A's in the electives, get your A's in your course, and then you can apply to medicine. And exactly, he did that. I think he got 7 A's or 6 A's or so.
Okay.
And then he asked me, now that I've made the grades, what next? So first of all, you are in secondary school. Take your science serious. If you're a science student, you want to do medicine, take it serious. Get your A's, then you can apply. So in my time, that was some years back, when I was applying for medicine, at the time, University of Ghana, it wasn't a straight entry.
Oh, okay.
So you do level 100 as biological science or as a biomedical science. And then at the end of your first semester and the second semester, you apply. Well, at the end of the first semester, you apply whether you want to go into School of Medicine or you want to go into dentistry or any of the allied health sciences, i.e. radiology, physiotherapy, lab medicine. So after my first semester, as in level 100 first semester, based on your GPA, then you make an informed choice. So I've had a GPA of this. Can that give me a space to read medicine? And then if you want to choose medicine, you're going to write your name that you want to apply for medicine.
Okay.
But you should be, influenced by whatever you have made. Because if you've made a very low GPA, it means you can't even have a spot.
Yeah.
Because there were a lot of people trying to fill that spot. So you write for medicine, for dentistry, and all that. So after the entire year, we'll add your cumulative GPA, and then if you had applied to go into to medical school, that is there. So we call you and list you to go for an interview. So in my time, for instance, there were a lot of people doing the biological science, biomedical science. At the end of the day, they took about 200 or 250 people to go for interview. Okay. Out of the lot. Interview specifically for medicine. And then, so that's that bit. After you've been taken to go for the interview, you go for the interview. And based on your performance, you are given a slot to read medicine.
I see.
Either to read medicine or as a fully sponsored Ghanaian student. That one, you pay fees, but not as much as those who are going to fund it solely by themselves. So you have a full fee paying that you fund almost everything by yourself. It's subsidized, but you pay chunk of the money, or government sponsored.
That's a regular student.
Regular student, just pay just a little. So that was back then. But now what they are doing is both Tech, that's KUST, and then University of Ghana,
Okay.
School of Medicine and Dentistry, and I think the other universities too, that I can't speak for them. They take direct entry. So
Okay.
based on your results that you've had from WASI, you apply, and if you qualify with their cutoff point, they give you a letter for possible admission into the medical school. Possible admission because you have to justify your inclusion.
With
So
another
there's
exam?
an entry exam.
Wow.
Yes. So entry exam that all of you go and write. And after they accept it and they get, those who do well, you write, you go for the interview. All right, so there's an interview, you tell them why you want to become a medical doctor, blah, 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 and all those things. So that is also there. And then they get their final selection into the medical school.
So you have to write. So after your WASI, you
After
do
the
an
WASI,
entry exam.
you do so by that time you should have applied to the school that you want to read the medicine.
Okay.
So based on your results, you are given a ticket to come to write the entry exam. All right. And previously, when they write the entry exam, that is when they whittle it down and they get perhaps half the number to go for the interview. And after the interview, they still whittle it down to half the number and they gain admission into medical school.
Wow.
But now, all of them have the luxury of going to write the entry exam.
Okay.
You have the luxury of going for the interview. But after the interview, they have their cut. Based on your WASI performance, based on the entry exam, and based on your performance at the interview section. All right, and that is it for School of Medical Sciences and Konfanoche, and I'm sure the other universities too.
Wow. I see. So how long does medical school last? Is it a 4-year program, 6-year program?
Yes, so medical school is in 2 phases now. I'm saying 2 phases because you have the regular stream where I don't have any degree. I'm coming from SHS.
Okay.
I apply. So I have a 6 years course to run. That's medicine, 6 years. So you go and you do 6 years. That's medical program. That's the one coming directly from SHS.
Okay.
But now there's also a program for graduate students.
Oh.
So I may have graduated with as a biomedical engineering or as a biochemist or as a radiographer, and I want to go to medical school. There's still an opportunity for you in that
that's
regard.
nice.
And that is a 4-year program.
Oh, okay.
It's a 4-year program. So instead of starting from level 100, you would start from level 300, you do 400, you do 500, you do 600.
Oh,
so
that's
a
nice.
4-year. So they recognize your primary degree and then you can move on.
Oh, that's really nice. There's one thing I've always wondered. When university here talks of people saying that SHS didn't really prepare them for the course they are doing in university. So I'm wondering that the science electives that is done in SHS, does it prepare you enough for medical school?
It does, but you realize that in your course of medicine, the program, you may have to fall on one information you gathered on your way from SHS all the way. There are times that you have to fall on some information.
Okay.
Because in medicine, it's not just about biology. There are times you need to apply your knowledge in physics to appreciate some principles. So if you have to understand the concept of heart disease, for instance, there are times they will say a Laplace principle.
Oh, really?
They say Frank-Starling forces. All those things were sort of treated in SHS.
Yes.
They are physics inclined in nature, but you need to appreciate the concept and then you can apply to the medicine.
I see.
So yes, it's not wasted. All those, you may not have a wholesome knowledge application, but there are times that you need to follow one thing or the other, and that really helps.
I'm wondering about elective maths, whether you use your elective maths in in medicine when you're studying medicine?
We apply mathematics anyway. If I want to calculate the dosage of this medication for this child, isn't it mathematics?
But calculus,
no,
this kind of
that
stuff.
is so detailed that it doesn't come in there. Yes, but I mean, if I have to do multiplication, if I have to, it's all in there, right? If I have to calculate the dose of a concentration, I'm doing anesthesia, how much of this drug would this 40-kilogram woman need? It's all of it. Right,
so there's a bit of
application, yes, here and there. You apply physics here, you apply mathematics here, and then your biology here and there. Chemistry, I mean, there's a bit of pharmacology in medicine. Yes,
okay.
There's a pharmacology we do. You have to have some basics, some foundation in chemistry, and then you build on. Okay. They are all important.
Okay, so if somebody wants to choose medicine, a person deciding between medicine or the other allied health courses, that's what you mentioned earlier, radiography and the rest, what should somebody know before choosing medicine as a profession? Is it, because I know most people in Ghana, it's said that people choose medicine because of job security and the fact that after school you are more likely to get a job with medicine as preferred to the other courses. I don't want to mention them because I don't want any problem.
All right. Okay. I mean, there are no two ways about that. I mean, if you know that once you go through medicine, you pass out as a medical doctor, your job is secure, right? Because we need doctors in Ghana. Private institutions need doctors. The government hospitals, we need doctors, right? So that is there. But don't be motivated by the fact that you have job security and it's prestigious as a medical doctor. Don't be motivated by that fact. First of all, the desire and the passion to become a medical doctor should be number one. And the fact that, are you people inclined? Are you the type that is drawn towards people? Do you have the welfare of people at hand? You should be motivated by that. Because trust me, if you start working as a medical doctor, then you need to leave your bed at 9, run for emergencies, leave home very early so you'll not be late for work. All that comes with a lot of sacrifices. There are times that they post you into some hinterlands. You have to leave your families somewhere, and then you have to be trooping maybe weekly or monthly to just have a glimpse of your family. All those are sacrifice. So if you don't have passion to start with, you realize it'll be very difficult for you in the course of executing your duties as a medical doctor. So the passion should be there. Don't be motivated by job security and prestige. It comes with it, but first of all, the basics should be right. You should be somebody who is tenacious, because in medicine, if you don't have tenacity, there are times that you'll be depressed. You will be. But if you have the can-do spirit, you have perseverance, you have the tenacity to forge on, even when crisis hits, you know that you have prepared your mind to face such in your journey. So,
wow. That's great. Now, I'm wondering that now we've discussed the point at which somebody has been able to enter medical school. So now we know it's going to take us 6 years to finish medical school.
All right.
So the 6 years, what are you basically studying? Is it basically, are you doing theory? Are you doing practicals?
Okay.
Do you go out to are you in contact with patients?
All right.
Then after that, how's the whole experience of medical school like?
Okay. So it's a mixed bag. You start with the theory. We call that the basic sciences. So basic sciences is when you are being introduced to medicine. So you are doing anatomy. Anatomy is grossly what is the body parts. So the head, the ears, the neck, the thorax, the abdomen, all that. So that we are in your basic sciences, they are teaching the theory of that. And there's a practical session of that where you actually work on cadavers or dead bodies.
So that is true.
Yes, where you go into an auditorium where there's cadavers or dead bodies, and you're using those bodies to learn the anatomy. Because if I want to appreciate the nerve that runs through the brain, the vessels that runs through the brain, I need to have a practical hands-on. So once you go in there and you are grateful to all those that willingly donated their bodies to be used for academic purposes. I mean, because it helps us a lot. You're able to appreciate that if they say heart, it's not just what you have seen on the video. It's not what you have read in a book. It is what you are seeing on the table. So you're able to appreciate, you're able to cut through. We call it dissection time.
So you
dissect the bodies and you're able to find, okay, if you say this is the right atrium of the heart, this is how it looks like. If you say this is the ventricle of the heart, this is how it looks like. So that's about the basic science. And it's not just anatomy, you do biochemistry. Biochemistry is, so in medical school, it's really difficult for most of us. So it's not a course for the average student. Even the medical students, they take the creme de la creme of the sciences to read medicine.
The best of the best.
Yes. But we still struggle with biochemistry. So it's taught at the basic sciences, and we do physiology. Physiology is appreciating how the body works, how things happen in the body, because everything is not by chance. If my heart is able to pump blood, what is the mechanism of action? How does it happen? So you understand those concepts. And there's also embryology, where it's about how organs are formed, how the baby is formed. How does your ear come in place when the embryo is starting developing in the mother's womb? How does it end up becoming a wholesome baby? All those things are.
That's interesting.
So that's the basic sciences years. That's like maybe the first 2-3 years.
Okay.
And then we go into the clinical sciences.
That's your 4th year.
That's from 4th, 5th, 6th year. So this is the period where we interact with patients.
Oh, okay.
So basically you do some theory, then you are literally thrown on the wards to go and interact with the patients with some guidance anyway. Because you have your consultants, you have your lecturers in there to assist you to what to do. So this is the time that they start building and developing a sense of interacting with patients to find out what exactly brought them to the hospital. So then, and the exam is also in that format, because you realize that at your clinical exam, you'll be given a patient and be given a period of, let's say, 45 minutes, interact with this patient, find out what has brought this patient to the hospital. At the end of your interaction, what was your diagnosis? How are you going to investigate and how are you going to treat this patient? So that's how practical it is.
Oh, I see.
Right? So your clinical sciences is just a mixed bag of theory, but mainly is a clinical work where you get to interact, and not just the patient. You go to the labs too to find out how the labs are done, how they read, how they analyze the kidney function test, how all the things in there. If you're doing a full blood count, the equipment to use and all that.
It's a very immersive experience.
Yes, it is. It is. So once you are out of medical school, you're actually refined. Yes, if you applied yourself in the process, you realize that you become 1,000 times better. Better than you came in. Obviously, you would have to. Yes, because of all the information you've gathered throughout there.
Oh, then that's great. That means that after you are done, so now you have graduated. What is the career path of a doctor after graduation? What do you do next?
Okay, so I graduate as a doctor. We're all excited because there will be some graduation ceremony and all the pomp and gentry and all that follows. That's the party. Now, you were trained to become a medical doctor, right? So then we have to affiliate you or assign you to a hospital to work in. So the first 2 years of the life of a medical doctor, we call it house job or housemanship, all right? So this is a period where you are attached to a hospital and you're attached to consultants, you're attached to specialists to assist you in training. Okay, so there's a time for you to get hands-on experience, and this is a time you are at the forefront. So as a house officer, you are usually the first on point or on call. So when a patient comes to the outpatient department or is rushed to the emergency, there are times you are the first person to take the history.
Whoa.
Right? To take the history, because mind you, you've been taught history taking in your clinical years.
Okay.
So you are applying the history taking principle there, and then you examine. All right. But there are times that we may not get everything correct. That's how come you have to present your findings to a superior. So if you are there as a house officer with a medical officer, so the medical officer is the next cadre after a house officer. You become a medical officer, and then you become a specialist. So if you're in a teaching hospital like Kolebu, where there's a house officer, and there's a medical officer, all forms of cadres are there. There's a specialist, even a specialist. You have a junior specialist, you have a senior specialist, right? And there's a junior resident, senior resident, all of it. So when the house officer interacts with the patient as a first point of contact, and then it comes to the medical officer, that's if there's a medical officer in there, or even if there's you can equally go to the senior resident or a junior resident and say, okay, so there's a patient who has presented with a fever, vomiting, and headache. And after interacting with the mother or interacting with the patient, I think that this patient has meningitis. This patient has meningitis, or this patient has malaria. So this is how I'm going to investigate the patient. This is how I'm going to do. All right. And will assess, further examine, further take history to corroborate what the house officer has given us. And if there are other things that the house officer may not have picked up, we are able to, because we have experience, we're able to pick it up and add on to the treatment. So at the end of the day, we have a holistic patient treatment, which will bring, great to the patient.
Okay. So, Doc, after your house job and now medical officer, what's the next step? What do you do after becoming a medical officer?
Okay, if you remember, I mentioned that there's a cadre, go through like a house officer, medical officer. If you want to remain as a medical officer, that's like you're a general practitioner. Well, you can stay there, but now most people want to subspecialize. They want to specialize. Even if you want to become a pediatrician, at the end of the day, which subspecialty of a pediatrician that you want to do is also there. All right. So after a medical officer, you write primaries to whichever specialty you're interested in. So, for instance, for me, starting as a medical officer, I wrote my primaries because I knew what I wanted. Because as your time as a house officer, you go through the major rotations, i.e. surgery, medicine, obstetrician and gynecology, and child health. So by the time you've gone through all these 4 rotations, there should be something that spurs you on. One of the rotations that you're so, happy about that you want to pursue. So at the end of my 4 rotations, I settled on becoming a pediatrician because I really enjoyed my experience as a house officer in that department. So I wrote my primaries. So you have to first write your primaries, and then once you pass your primaries, you go for an interview, right? And if you pass the interview, you're given the admission to read your choice of specialty. And that you do is a program for 3 years or 4, depending on which one you're going to read. So for child health, it's 3 years, and after 3 years, you write an exam. Once you pass the exam, and the exam is very intense because you're going to be passed as a specialist. You should be worth the title. So they scrutinize you in every aspect of the course. And then once you pass, you become a specialist. And once you're a specialist, there's still some other things ahead. So you want to become a fellow. So that's when you apply to do 2 years more of further studies. And after that, there's a dissertation that you have to defend. There's some research programs you have to do. And then there's also a panelist interview and, bringing out what you have learned, all that. That's also after 2 years. And then you become a fellow in that specialty. All right. And if you want to go into academia, that's also there. You have to write articles, you have to do research. So it doesn't end. All right. It doesn't end. There are times that when you start the program, because it's so intense, and it's entirely different if you are in medical school and then you are working, you're a family man or a family woman, and you have to marry all the things that you are doing to be to still make it to read your books. It's difficult, but once you apply yourself, and there's one thing that has always helped me, that the fragrance always remains in the hands of the one that gives the rose. So what I usually do is if I learn the thing, I teach other people.
Oh, okay.
So the more I speak it out, it stays with me. And if it stays with me in the exam, if they're asking you, you'll be able to recall. And it's become so practical as second nature. So that's about trying to do.
That's great. I mean, anybody who watches this video will have a very balanced idea of how you can become a doctor in Ghana. I mean, what you should look out for. But I'm wondering that at which level do you become a lecturer? Can you become a lecturer as a medical officer?
No.
You can't.
No, maybe perhaps a part-time lecturer, obviously not in a medical school. A part-time lecturer in the science-related something that you want to. Yes, but to be recognized as a lecturer, you need to be a senior, at least a senior specialist.
Senior specialist.
Yes. And a senior specialist, you have to go through residency, junior residency, senior residency, before you become a senior specialist. Even that one is a part-time lecturer. You become a full-time lecturer.
Wow.
Yes, you need to be a consultant.
That's about 10, 15 years.
Let's say from medical school, 10, 15 years.
Yes.
So assuming you complete medical school at the age of 25 and you want to go by 40 years, you should be
that's long.
A consultant. I mean,
it means that you cannot...
If you play your cards well and you know where you're going, so that you don't skirt around the mountains for too long, you're doing here, not decide which way you want to go, and then you have a roadmap where you want to go, it becomes so easy.
That means that if you cannot decide to wait to become a lecturer in medical school before you maybe want to start life, like have a child and marry and those kind of stuff. Because it means that as you're looking at 40, 50 years.
It depends on your strength. Some people would want to, right after house job, write their primaries, start the program, become a specialist before they start having their family. All right. So
that's about 5-6 years.
Yes. So let's say 5-6 years. And some people too want to have their children, finish that aspect before they start pursuing their membership. So that's about
so it. Depends on the individual.
Depends on what works best for you.
That's
some people want to build their houses, do all the locums to get a lot of money, settle down before they start the program. Because like I'm saying, it's very difficult if you have to be self-motivated to do that adult education, right? So,
but you can decide to also be a medical officer and you'll be fine.
Yes, it can be decided. So once after medical school, if you don't want to pursue, it's up to you.
Are there people who don't pursue?
Yes, there are people who remain as medical officers. So then you go through the ranks. So there's a medical officer, senior medical officer, chief medical officer, principal medical officer. So it comes with a promotion. But if as a medical officer, you just want to jump all those and become a specialist.
So it means that a specialist is higher than a chief medical officer?
Not necessarily, just that you have specialized in one corner. So you've zeroed into a specialty. So that if I'm a pediatrician, I've cut corners, tails with all those other. I don't have to come and be seeing an older adult. Maybe I can see an older child. Yes, so I see from all those things.
But you still have the experience of dealing with adults.
Yes, you still have experience.
So you can still...
I do part-time, and when I'm going for that locum, I see everybody.
Okay.
If I'm in my hospital, that's when I'm seeing only children. But if I'm doing my locum, I'm seeing everybody. And there are times you have to fall on the experiences you gathered as a house officer. Yes, and if you had applied yourself in those rotations, it comes in handy.
So it helps?
It helps, it does. So now I can give consult to my father, to my mother, to my grandparents, because I still have my medicine, right, as a medical officer, as a house officer, right? Yes.
So it's good. So thank you guys for watching today. As you know, before we come to the end of the video, he's going to tell you guys to like and subscribe. I know that this has been a very involving video, so you have to take your time and listen to it and break it down. But if you still want to pursue medicine as a profession or as a career, from the explanation he has given, it's going to give you a lot of information to take the time to take the decision. For the specialty, I'm sure for those who are already about to finish medical school or you are going to start your house job, you will, as you're doing your, rotations, right?
Yeah.
As you're doing your rotations, you'll find out what you love. But I think, like he's saying, the most important thing is to do stick to what you love, or stick to the specialty you love, so that you'll be able to get the most out of the profession, right?
Exactly. Don't be motivated by money and other things. Yes, because obviously some specialties pay more than others.
Oh, okay.
Yeah.
So be motivated by the money. So Doc, over to you. So you can tell our viewers to like and subscribe. Then we
So
end
what
this.
was the channel again?
Then Daily News Hive.
All right. So thank you for watching. Kindly like and subscribe to Daily News Hive. Thank you.
All right, guys. Thank you for watching, and see you next time. Bye.